The aim of the study was to create an entrepreneurship framework to stimulate employment creation in the South African healthcare industry, specifically by retaining complementary healthcare professionals through the provision of alternatives to the closure of private practices and them exiting their professions, the allied healthcare sector and the South African healthcare industry. The integration of the TIPS framework in the study was directly relating to the entrepreneurship framework that was presented at the end, where we looked at the different areas of technology, innovation, people, and systems. Since the healthcare industry, the allied healthcare sector in that industry is systems or systems interlinking with each other, directly influencing the complementary healthcare professionals as people, how they include technology in their workspaces, but the framework specifically looked at innovation and how to stimulate the innovation of complementary healthcare professionals. So with some practical advice and practical steps made in the conclusions and recommendations of the study, hopefully that will help the industry in the right direction and possibly retain more complementary healthcare professionals in the field that has a great need for assistance and for dealing with the overall majority of the South African population's need for healthcare services. Overall, for me, the PhD was a long journey. I've discovered more about myself in the process, and it was just interesting that I had exactly the same supervisor, which is Professor Marius Harold, that I had when I did the doctoral degree previously. So even in that sense, it felt to me like a process of restoration where I've done a qualification and I had to redo a qualification, if you can put it like that, in order to continue supervising master's degree students that I'm doing, and which is something that I love to do.